during our sorry na. Hello everyone. I am Cristina Sheryll Pinpin, a Doctor of Medicine specializing in the field of Obstetrics and Gynecology. Currently, I am the chairman of the Department of Obstetrics and Gynecology at PRI Medical Center. I finished my Bachelor of Science major in Biology at English University Foundation, and subsequently, I took up a Doctor of Medicine at English University Foundation. Also, for my residency training on the same institution in the field of Obstetrics and Gynecology at English University Foundation Medical Center. Right now, I am a board-certified fellow at our society. Also, I took up, just graduating this year, Master at Hospital Administration at Philippine Christian University. And right now, I am now the chairman at currently at PRI Medical Center. I chose this career, the field of obstetrics and gynecology, because this career is deeply rewarding and fulfilling. It gives us the ability to make a positive impact on our patients' life during their significant life events, especially like during childbirth. It's very significant and important to a woman's life. And it offers us a variety and challenges from like routine prenatal care to surgical interventions, and it is very challenging, and I really like the specialty. For obstetrics, obstetrics meaning medical science that deals with pregnancy, childbirth, and the postpartum period. So a lot for obstetrics, the common conditions for obstetrics. Because pregnancy is not an illness, it's a condition, but it entails a comorbid problem. Okay, and the common are the gestational diabetes mellitus, preeclampsia or hypertension disorders, preterm labor, miscarriages, also ectopic pregnancies and infections. And for the gynecology on the other hand is a medical science that deals with the reproductive tract of women. And the common conditions here are the pelvic inflammatory disease, the urinary tract infections, and endometriosis. Endometriosis is also a condition wherein the woman experiences severe pelvic pain during menstruation, and bloatedness, disabling life. It's very bothersome for this woman, so we treat them also with that. Also, a common is the polycystic ovarian syndrome, menstrual disorders, breast conditions, and presence of fibroids. They're pretty common in our field. So it is important to have a regular checkup with your OB/GYN on this time to detect and treat conditions early, because preventive care like mammogram, pap smear, and routine pelvic exams are very necessary. Being a mom, rewarding, fulfilling. Sometimes it's surreal because you will just look at them. Pinanganak ko ba itong mga to? Akin ba itong mga to? And then when these kids of yours, when they express their love, their satisfaction that you are their mom, I think that's the greatest reward that any mom could say and champion. That's the most fulfilling thing. The love of their kids, knowing that parang ikaw ang all and all nila, be all and end all nila sa buhay nila. So, hindi mapapantayan yun kahit money or anything. It's very fulfilling. I've had 5 kids, but right now, I just have 4 live births. The middle kid was a miscarriage. So right now, I have 4 children, 2 grown-ups, and ages 24, 22, 15, and 12-year-old children. I was still in school when I had my first kid. So, sakto lang, I was in my early 20s. At that time for me, it was very difficult because I have to struggle school, working at the hospital, and also the stress of the pregnancy. It's very taxing for me. But, with God's grace, he was my best friend. He was everything. I was able to go with it with flying colors naman. I was able to breeze through it. And then, wala namang kasing ang pagiging mommy, parang wala naman talaga siyang guide. Everything is an instinct, and with God's grace, you just go with it, with the flow. As long as you're prepared, emotionally, financially, physically, you can go with pregnancy. Well, at the moment, our cutoff is 35 years old. Because, meaning to say, being 35 doesn't mean you're not allowed to get pregnant anymore. You're allowed, but you get a bit of a risk. Risk for miscarriage, risk for some problem. But again, we as OB-GYN, we are there naman to help you go through with that risk. So, sana, maybe reproductive years 25, between 25 to 35. That's I think, a good age. Kasi, along that line, you may be already financially okay, you're working, emotionally okay, and physically okay also. So as long as you're ready, okay lang. And of course, not only with yourself, yung support group mo, dapat supportive yung partner mo, supportive yung family mo. So it entails a lot of factors also.